Hi, so yeah, thanks very much for the invitation, Alessandro and Fiona. My name's Kate, and I'm going to come and talk to you about the Cancer Research Project Manager Network that I run in liaison with Emma Thorpe from the Christie and Rebecca Elliott from the University of Manchester. So essentially, the network aims to use our experience and influence within cancer research in Manchester to encourage and empower individuals to change perceptions and expectations of the role of project manager to enhance cancer research delivery. So the majority of the work that goes on in cancer research in Manchester is actually based at the Christie site in Withington, sort of Didsbury border. But we do have members from the University of Manchester, the Christie, MFT, Cancer Research UK, MI, MCRC. So just a little bit of background about why we set up the network. So it's essentially set up to support project managers working in cancer research across Manchester. By the nature of where cancer research is located, we are off campus. I've been doing a sort of programme management role now for 12 years plus. And when I started in that role, I was quite isolated. We tend to be occasionally sort of one lady, one man bands supporting a research team, but you're off campus. And I was noticing, both Rebecca and I were noticing that we would sort of meet project managers just by accident, and quite often a few people were leaving because they just felt so isolated, there was no support. I sort of describe us as hybrid professional support and research staff. And the way it's set up with the university, we sometimes sort of fall between the cracks in terms of line management. So we needed to set up a network to support each other. We started relatively small and we mainly comprised university staff. But certainly with Emma's leadership, we've now grown into a membership network of over 50 project managers or staff basically who are involved in research management across the university, the Christie and MFT. So essentially, we offer a buddying and mentoring kind of support network. We look very much to develop project managers and offer sort of training sessions. We discuss between the network where we think that we need additional training. But alongside sort of supporting each other, we also support academics in cancer research who are perhaps thinking of incorporating some sort of project support into their teams, and I can just describe that a little bit later. So our network, we meet once every 2 months. We tend to have guest speakers or just general talks from various departments across the university and NHS that we would deal with. We have subgroups that focus on communication, training and development, but also event management. So, you know, I'm doing more of these talks that the longer our network has been existing. And it has taken several years. So if there is anybody in the audience who's trying to set up a network, don't be put off. This has taken several years to start to begin to sustain itself. We've got a really good team site now. And we've got, our members just seem to be far more engaged and active. We have, I would say, at least daily posts, people asking queries or sharing best practice or signposting. We've developed a how-to document repository, just things like how to pay, patient advocacy, honoraria, issues surrounding VAT purchasing, research incomes reporting, things that may take you a long time to try and find out how to do things, but as a network, if we've done it before, we just quickly post on the team site just a really sort of brief document on how we've managed to deliver things. And overall, actually, we just are there to offer support for each other. So this slide essentially is trying to sort of explain where we fit into the research pathway. So I'm hoping that most of you will understand this team science ethos that we have in Manchester, very much championed by Rob Bristow, head of MCRC. And the project managers are here to enable multidisciplinary collaborative research teams to deliver high quality cancer research. So I think we could probably all agree that getting a research project off the ground is very complex. It involves a lot of different departments, both across the university and trusts, but also other stakeholders and collaborators, such as a sponsor, a CTU, funders, be they charity or pharma. And the common thread is that project managers are behind the scenes making sure that this research actually happens and that we are part of the process of development, setup and delivery. So this is my slide that suddenly disappears for some reason, so I'll bring it back. So we presented this slide at the Greater Manchester Cancer Conference, and I really like this honeycomb structure here that really illustrates our combined skills and where project managers are involved throughout that entire pipeline. So as you can see, we routinely will lead on patient advocacy, funding intelligence, i.e. looking for sources of funding. We're quite often involved in study design and certainly application stage, collating costings, liaising during setup with the contracts team, HR, preparing job descriptions, sitting on interview panels. All of the ethics applications are usually sort of led by the project managers. Once we've set up a project and it's actively running, we will be preparing clinical trial documentation, managing the budget, liaising with funders, contributing and writing reports through to close down and publication. And in this poster, we decided that it would be great to add this snapshot of publications where project managers have been included in the authorship. And I think this sort of just shows this team ethos actually in practice, the fact that we are pivotal members of the teams and therefore, you know, our contribution is reflected in publications, abstracts, manuscripts, etc. We have quite a lovely set of quotes here from academic champions. So we've got John Radford, Corinne Finn and Anya Chowdhury, clinical academics, who just say really nice things about project management, as well as Professor Stephen Taylor, who is the head of the Division of Cancer Sciences, who is very, very supportive of the work that the project managers and the network are doing. So our vision is threefold. So we want to be recognised as having valued roles that are integral to research teams as part of the team science ethos that underpins the delivery of cancer research in Manchester. Our network will drive the delivery of the research and will lead the way in defining and developing project management as an independent and recognised profession. So we're here to really increase our visibility within the university and the trust, and showing the value that we add to the delivery of cancer research. We're very keen to develop research project management as a profession, and we are trying to work at quite high levels within schools, faculty and the university as a whole to better understand how we can actually develop this further, support each other and really overall improve project management experience as sort of employees. So this is our page in the Translation Manchester brochure, and essentially the translational stage is supported here. I've talked to Alessandro and Fiona before this session. We actually feel, having discussed it in more detail, that project managers in cancer research actually are supporting the full translational pathway from basic science all the way through to practice change. So we do have project managers from in the basic levels, such as Caroline Dives' work, although she's not just basic science, all the way through to practice changing delivery, such as the work that John Radford and Emma Crosby is doing. So I just think as we have grown as a network, we have certainly begun to realise that we're part of that pathway from beginning to end. In terms of supporting academics who think that they might benefit from having some sort of project management or project support, this has certainly become something that we're more active in that academics are signposted to the network and they quite often come to speak to me, Emma or Rebecca. Usually with the sort of introductions, right, I need a project manager, such and such team has got a project manager and I know it works really well. But what we try to do is we've developed a very nice skills matrix looking at the sorts of input that research managers or coordinators or facilitators can provide, essentially sort of going through the various gradings that we would have, so at the university sort of grade 4 up to grade 7 plus, and those skills that can be offered to support a team. When we talk to the academic about that, you can sort of pinpoint then what needs to be put into a job description, the sorts of people that you need within your team. And then we tend to sort of be able to offer to help draw up the job description, sit in on interview panels. And by doing that, we're also capturing those new starters and bringing them into the network. So when they start, they don't feel isolated. They feel that they are part of a team and they do have some support, which I think is, you know, really why we wanted to set up the network in the first place. So this is actually my final slide. And we think that we have captured the majority of people who are actively involved in research management within sort of oncology in Manchester. We did a bit of a wider call out recently, which led to an increased membership. But if you are listening and you kind of think that this network, you know, you are doing project management with a cancer remit, then please feel free to contact myself or Emma and Rebecca, and we can talk to you about it and obviously add you to the network and to our team site. And just my final slide, I'm hoping this is going to work. So this came live today, our website. Does this work? Can you all still see that? And Sandra, will you just give me a nod if that's shared correctly?
We can still see the presentation.
Okay, hang on, I'm going to stop sharing and just see if I can do it here and then share. Where have you all gone? Here we go. Can you see that now?
Yeah.
Yeah.
Perfect.
So this is our new website, and on those slides it's got the link to this. And so this is essentially what that talk's been about, of our vision, what we do. But there are some really nice quotes here we have from Stephen Taylor, but also from project managers, sort of giving more of an idea of the projects that we've been involved with, our contribution, what our kind of day-to-day lives are like. We're hoping to get a few more photos of it. It's very text heavy. But yeah, if you wanted to have a look at that, please feel free to do so. That'd be great. So yeah, thank you very much. And if you've got any questions.